For our first hearing, we're taking on the topic of the implementation of the Mission Act, something that this committee and Congress has spent a lot of time on over a long period of time on community care. And I thank you, Dr. Stone, for you and your team joining us on today's first panel. I also thank the witnesses on our second panel for being here. I look forward to hearing their perspective as well. Certainly believe that the delivery of quality and timely health care to veterans has been a top priority for this committee and for me. When our service members leave the military, it's our duty to make sure they receive the care that they have earned. Congress enacted the Mission Act to transform VA healthcare into an innovation and responsive 21st century healthcare system capable of addressing the challenges with veterans today. And I think there is a important point to be made that the Mission Act, while we talk about, and I just did it, community care in the community, it is much more than just that. Our hearing today will focus on the efforts of the VA to deploy community care networks. The network is central to the mission's Veterans Community Care Program. When I was a congressman, I represented a congressional district size about the same as Illinois. No VA hospital in that congressional district, and so I bring a perspective of distance and travel time to my job in trying to care for veterans. So in part, I always remain interested in how we care for veterans who live long distances from the VA's presence and how we can expand that presence to them. The VA recently completed Region 1 deployment of the network, and the first 4 regions representing the lower 48 states are scheduled to be completed by the end of this year. The committee has concerns about how the VA is building out the network and its ability to meet veteran demand. Under Mission's expanded eligibility requirements, the number of patients seeking outside care is supposed to increase from 648,000 to 3.7 million. A recent VA OIG report predicts wait times could worsen once Mission is in full effect. This is in addition to reports that the VA is still struggling with the scheduling delays and paying community providers on time. We want to make sure this does not occur and look forward to working with you, Dr. Stone, and others at the VA to ensure that. We must take the opportunity to learn what happens in Region 1 and have an honest conversation about the difficulties that could threaten the network well before it's fully deployed. We owe it to the veterans to get Mission right the very first time. I now turn to my friend and ranking member, the senator from Montana, Senator Tester, for his opening statement.